The topic for today, the future of the ACA and the impact of repeal and replace, is also impactful for our school in particular.
The main concern about repealing the Affordable Care Act, I think there are really two concerns. One is whether, in the long run, more people will end up uninsured. And we know that uninsured people, not only do they have delays in receiving health care, but their health outcomes are worse. People who don't have health insurance die younger, have a greater burden of illness, get less appropriate treatment for their care, and it leads to an even greater disparity between the quality of life of the rich and the poor in this country. In the shorter term issue, if the Affordable Care Act is repealed without a good plan to fund health care, there will probably be immediate, very significant financial impacts to both hospitals, healthcare generally as an industry, and to state governments who are whose in every case whose largest expenditure is healthcare through both to their employees and to Medicaid.
As a physician and health policy specialist, what concerns me most is that the Affordable Care Act has really done a fantastic job at increasing access to affordable health care for many millions of folks, over 20 million, over 30 million. If you include the people with pre-existing conditions, 60 million people could be affected by a repeal of the Affordable Care Act. The Congressional Budget Office just last night published their analysis of the current repeal law, which demonstrates that within the first year, just the repeal would lead to at least 18 million people losing their health insurance right away, and increases of 20 to 25% for those who are buying their own health insurance. So the impact is enormous and immediate if the repeal efforts as currently constructed go through.
This law is not perfect, and many of us believe it needs to be tweaked in certain ways, and we had hoped over the last several years to be able to work in a bipartisan way to tweak it, to make it as good as it possibly can be. But ideology and politics got in the way, and it was either repeal or do nothing. In the House of Representatives, we voted to repeal this bill 60 times, and no replacements. And we just voted last week for a budget that provides instructions to the relevant committees to go about the business of repealing the Affordable Care Act. I think it's a bad idea. I think it's a dangerous idea to repeal this act, especially without any kind of replacement. I mean, literally tens of millions of people could lose not only their benefits, but tens of millions of more people can lose the health care protections that are actually built into this law.